My name is Byeong-Keuk Kim, working at the Yonsei University Severance Hospitals. I'm the director of the cardiovascular case room. As everybody can know, recently many data show us the positive findings of the imaging guidance, especially for the complex reason. So, however, usually the most study was done by the IBUS as the primarily the tool for the imaging guidance, but the OCT guidance remained some insufficient data, especially the ACS complex region. So this study focusing on the complex region having the ACS. Actually, this study was the subgroup analysis of the OCCUPI trials. OCCUPI trial was presented last ESC and simultaneously published in Lancet last year. So this study is a patient with complex lesions is randomly assigned into OCT guidance and angio guidance, and we compare the clinical outcome. So in this study, complex lesions include the CTO or long lesion, small vessel, bifurcation, and left main, and AMI, stent thrombosis, intracoronary thrombus. So this study, our subgroup analysis study is focused on the a patient with the ACS, meaning the complex lesion ACS patient, and then compare the two different strategies is OCT guided and angio guided. The primary endpoint was cardiac death, MI, stent thrombosis, and TVR rate at 1 year. OCCUPI ACS study is from the total enrolled patient from the OCCUPI trials. Approximately half of patients had ACS, and then among the 709 patients with ACS, we compared the OCT guidance and angio guidance. At 1 year, the occurrence of a primary endpoint is the OCT guided group showed a significantly lower rate of the primary endpoint as compared to the angio guided group in the ACS subset, especially the overall MI rate significantly lower in the OCT guided group, and also OCT guided group showed a trend toward having a lower rate of cardiac death or TVR at 1 year as compared to the angiography guided group. This finding of ACS subset is quite similar with the model study of OCCUPI trials. The meanings, as previous told you, the lack of data supporting the ACS, even with the guidelines, is the use of OCT would be the recommended. However, this study is also supporting the direct evidence of the OCT guidance for the treating ACS complex region. So this is the focused on this study subset. This study in ACS subset showed some significant and consistent findings. However, in the future, we need more detailed OCT criteria according to the clinical presentation, meaning the stable or MI or unstable angina. Definitely we need it. And also the major determinant of the OCT or angio guidance according to the clinical presentation needed. And also, for the perfect OCT guidance, pre-stenting, OCT imaging is also important. So that kind of some association between the pre-OCT findings and clinical outcome is also needed in the future. We are planning to investigate of this.